Hi, I'm Dr. Jerry Sims from Center of Reproductive Medicine. I have some comments about bleeding in pregnancy and miscarriage. Vaginal bleeding in pregnancy is very common. There are many causes. It may occur early or later in pregnancy. Sometimes bleeding may arise from the cervix following sexual intercourse, or may be associated with infection. Your doctor may perform a pelvic exam to help determine the source of bleeding. There are, however, many situations where bleeding is associated with the pregnancy and may pose a threat to you or your baby. You may be asked to come to the office for an exam to see if bleeding is coming from the cervix. We may do additional evaluations such as ultrasound to help determine the status of the pregnancy and the location as well. When bleeding occurs in early pregnancy, we do have to be concerned about the possibility of miscarriage or ectopic pregnancy. You should call your doctor anytime you have bleeding during pregnancy. Bleeding does not always mean that a miscarriage will happen, but it does mean that the risk may be increased. Many women who have vaginal bleeding in early pregnancy have little or no cramping and the bleeding stops. When this is further evaluated with ultrasound, a determination can be made about bleeding arising from the pregnancy and can help reassure that miscarriage is less likely to occur. If you experience bleeding in early pregnancy, but the bleeding resolves, chances are good that the pregnancy will continue without further complication. However, certain restrictions may be recommended, such as decreasing activity and avoiding sexual intercourse. Sometimes, however, bleeding can become worse and actually lead to a miscarriage. Signs and symptoms of possible miscarriage include vaginal bleeding, uterine cramping, which can be more severe than menstrual cramps, and passage of tissue. Sometimes tissue is expelled completely, but sometimes there may be retention of some tissue. This is called an incomplete miscarriage. Incomplete miscarriage may be completed by medical or surgical means. This tissue may be evaluated for chromosome analysis to determine if an abnormal chromosome was the cause of the miscarriage. If you think you have passed tissue, bring it to the doctor's office. It may be possible to test the chromosomes. Bleeding in early pregnancy can be evaluated a number of different ways. It is sometimes helpful to measure the level of HCG in the blood. This is the hormone measured with a pregnancy test. This is especially helpful in early pregnancy prior to the time when ultrasound can be used to visualize the pregnancy. Ultrasound is helpful beyond 6 weeks of pregnancy when we have the ability to see the baby, the heartbeat, and evidence of bleeding associated with the gestational sac. We also confirm mother's blood type and evaluate the need for Rh immunoglobulin, or RhoGAM, which is used when mother's Rh may differ from the baby's. This helps prevent complications due to Rh sensitization in future pregnancies. Sometimes we discover a pregnancy loss on routine ultrasound without any prior signs or symptoms of miscarriage. This condition can also be handled with surgical or medical treatments. Most times, a miscarriage cannot be prevented. We do not think there's any evidence to suggest that miscarriage is caused by exercise, sexual relations, stress, or labor. Miscarriage is virtually never caused by something you did or didn't do. The majority of miscarriages are related to an abnormal pregnancy. This can occur when the embryo receives an extra chromosome at the time of fertilization. Sometimes embryos with an extra chromosome may lead to a live birth, such as with Down syndrome. Many times, however, embryos with abnormal numbers of chromosomes are not able to divide or grow and result in miscarriage. Miscarriage is more common with the increasing age of the mother. In women over 40, miscarriage can occur in up to 1/3 of pregnancies. Having a miscarriage does not mean that you cannot have any children. It does not mean that there's something wrong with your health. If you have 2 miscarriages in a row, however, your doctor may consider special tests to evaluate your risk for miscarriage in future pregnancies. After a pregnancy loss, you may need time to heal both emotionally and physically. For many couples, emotional healing takes the longer amount of time. Your feelings of grief may include sadness or depression one day and anger the next day. You may be searching for a reason why the pregnancy loss occurred. You may wrongly blame yourself. You and your partner may express feelings of guilt differently. Your partner may feel the need to be strong for the both of you. This may cause tension between the couple at times when they need each other the most. If you or your partner are having difficulty dealing with these feelings of grief, you may find it helpful to talk to your healthcare provider. You also may find help talking with a counselor. Support groups can be especially helpful for couples dealing with this loss. CORM has support group meetings the last Thursday of every month at 5:30 in our Webster location. We're also available at any other time to help you cope with these difficult experiences.